when the child now develops dehydration, and then dehydration can now make the child develop jaundice.
Okay.
Yes.
So the key signs parents should watch out for.
Okay, the key points, number one is as soon as the child is delivered, we usually advise that, initiate cord care. We advise on those practices that will ensure or reduce the development of jaundice in newborn babies. Hygiene, cord care, initiation of breastfeeding as soon as possible. Ensure we visually advise babies poo minimal of 2, 3, 4 times a day, which is a good one. Passage of urine, those are all things we usually watch out for. And then as soon as the mother notices yellowish discoloration of the eyes or the skin, don't assume your child is a fair-colored skin, because a lot of people have this misconception. They believe their child is fair. Oh, wow, I have a fair child. And then by the time they're coming to the hospital, it's already severe and possibly at the point of causing irreversible damage to the newborn. So generally, watch out for yellowish discoloration of the eyes. And the best place to actually assess for that is intermittently from time to time, not inside the sun, but in a very well-lit area environment. Check the eyes for yellowish discoloration. Check the baby's skin for, and then even sometimes when the cord, you can see some yellowish discoloration, even on the cord area, umbilical cord area, could also be noticed.
So it's not like there are specific tests that are usually carried out.
Yes, that's just at the level of the home.
Okay.
But the level of the facility, hospital, we go further to do investigations. We do what we call total serum bilirubin. We could also, where we are not sure of the parents' blood group, we also do that. Where there's history or suggestive that the mother is rhesus negative, we also do some other investigations, which is a Coombs test. To from birth, immediately a baby is delivered, we take the cord blood and investigate to check to see if that baby is a candidate that may ultimately develop a severe form of jaundice, so that we can start managing it immediately. So generally, we advise as soon as parents see any change in color, please they come to the hospital where we'll clarify. Because most times for severe jaundice, it's a retrospective diagnosis in the sense that it's something that I've had has already happened. So you don't take chances. We want you to come to the hospital first. Let the doctor or the health worker check first, investigate, and then guide as appropriate.
Okay. So are there factors that make some babies more prone to it than others? Because like you explained earlier, sometimes the parents at home, especially for new mommies, they feel like, oh, my child is just fair in complexion, and they stay back at home. So by the time they come to the hospital, the jaundice has been far, into the baby. So are there some factors that make some babies more prone to it than others?
Yes. For instance, for a mother who is a rhesus negative mother and she's married to a rhesus positive father, there's every risk for not just the first baby, because first babies are usually most times protected even if they are rhesus positive.
Okay.
So for subsequent deliveries, she needs to come to be vigilant. That's number one. And then secondly, she can come to the health facility so that some investigations like the blood group of the newborn can be done, and then to rule out where probably she didn't get the in quote standard antenatal. Okay. Where standard antenatal is received, most times will have the doctor or the health facility she goes to will have presumed that the baby is the new inborn, the child in utero is at risk of developing jaundice. So she's prepared, that prepare her mind so that but as soon as the baby is delivered, we do what we called cord blood tests.
Okay.
And then the cord blood test will now give you an indicator whether that child will develop jaundice or not. Okay. That's number one. Then for a mother who has had a child with jaundice in the past, there's every likelihood that this particular pregnancy too, after having the child can also develop jaundice. So as soon as she delivers the child, she is supposed to be vigilant too, on the watch out. You see mothers in the hospital telling you that I've had 3 or 4 babies who have had all jaundice. So these are babies these are mothers with high risk pregnancy, high risk in the sense that the babies delivered could also develop jaundice. So in such cases, it needs to be very close to the facility or come to the facility as regularly as possible so that a baby can be investigated, and then if jaundice is diagnosed, baby can be treated properly.
Okay, so that's very, very important information, especially for new parents. But what happens after a diagnosis is made? Now, let's look at how jaundice is treated and what when it becomes, a serious concern. At what point does jaundice become dangerous for a baby?
Okay. Usually, when they come to the health facility, we do what we call an investigation, what we call the total serum bilirubin assay, and then when the levels. Usually we admit, as soon as the levels reach what we call 12 milligram per DL, that's the unit, we admit the baby for phototherapy. That's the mainstay of management as a treatment. We start with what we call phototherapy, which is a blue light, range of blue lights. We place the baby under, and which there's some processes, chemical processes that occurs as the blue light hits the baby's skin and then converts the bilirubin from the harmful type to the non-harmful type, and then is now easily absorbable type, which is now easily excreted through the urine and stool.
Okay.
And then, but for any instance, for any reason, because there are two types, we have the conjugated and we have the unconjugated bilirubin. For the conjugated bilirubin, for that, as soon as you make an investigation, you check your serum bilirubin, it gives you an idea of what type you are dealing with. For the conjugated, they are dealing with probably an issue that could not just be handled with just mere phototherapy. So for such individuals, you go higher up, you do other treatment modalities for the baby. For the most common type, which is the unconjugated type, when you check, you see the levels around 12 milligram per DL, we admit for photo. Where it goes beyond that, you're saying a child is already almost 20 milligram or even up to 20 milligram. You're already dealing with severe kind of jaundice.
Okay.
So for some individuals, we will do what we call exchange blood transfusion. In exchange blood transfusion, we remove the circulating blood as well as the high bilirubin in the system, and then we now replace it with a fresh blood, a fresh blood. And most times we also continue with phototherapy, and most babies do very well after a phototherapy session, except if depending on the type, because just like I said, if sensitization in quote has already taken place inside the womb, so for such you go further for other treatment modalities, because in such cases you have to go through extreme blood transfusion, not just once, you do twice, sometimes even do 3 times. And that's why we always say come early, because when you come early and diagnosis is made early, treatment management is instituted early, the outcomes and complications are reduced.
Okay, so you spoke about, changing the blood, which is, changing the entire blood in a baby's body. How do you sort of get the new blood, like you said, having a new blood in the baby's body? Is it usually from the mother, or, you just get to buy blood like they sell at the hospital and then they replace it for the child?
Okay. Most times, in blood banks, we do what we call screening, and we now get a donor.
Yes.
Because we usually advise parents to get if the father's blood, because most times you discover that such babies, if it's especially resource incompatibility cases, the baby's blood is usually most times compatible with that of the father, except if there are other indications or contraindications that the father may not donate. For instance, hepatitis B, HIV, you understand, other infections that are contraindicated for transfusion. Otherwise, if the father's blood is compatible, let's say the baby is A positive, the mother is B negative, and the father is A positive, so that father's blood can actually be used. So there's a way we do the calculations. There's a right amount. We don't do 100% exchange. You can, at most, what you do is actually 75% exchange, and 2/3 of the blood. That's the maximum you can actually go ahead and do an exchange. Exchange the blood, You take out the baby's blood, discard. You take in the father's blood. We do what we call in aliquots. Aliquots, it's in particular volumes, small volumes. You now push, and then you take out, you put. As you're taking out, you are discarding. You're also taking the fresh blood from whoever the donor is, and then you are now pushing it into the baby.
Okay, so
yeah.
Okay, so you spoke about going to the hospital when you notice your child has jaundice. Are there any points where jaundice can be treated if it is mild at home, or does it always require hospital care?
Yes. Usually for learned individuals, most times you discover that it's something that they are quite aware. And honestly, we see them often in the hospital. You see them 1 day, 2 days. As soon as they observe yellowish discoloration, they come in, they rush in. Most times what we practice with people that tend to believe on more of cultural practices. And that's the reason why we always advise that as soon as you observe, don't treat at home. Some will use glucose water. Some will tell you use a breast milk, drop it into the baby's eye. Some will say, okay, place the baby under early morning sun. There are a lot of practices associated with jaundice. We discourage that as much as possible, because we know by the time, many a times they're coming to the hospital, you don't even see them most times until the child has refused suckling. By the time the baby is no longer suckling, you know that jaundice has already affected what we call the brain. It has gone through the blood-brain barrier, the BBB, and by the time it gets into that, most times the damage is irreversible. By the time, and then it causes long-term complications in the newborn.
Wow. Okay. What are the, before we go on a short break, what are the potential complications if jaundice is not treated on time?
Well, there's what we call the acute one we call is acute bilirubin encephalopathy. That's a terminology, just simply put, it causes a lot of symptoms like poor suck, high temperature, very high temperature, abnormal baby movement, as you see, like convulsions, and then it also causes some other metabolic changes within the body, the system of the baby. That's for the short-term complications. And then for the long-term complications, it causes learning disabilities, deafness. It can also cause mental retardation. And then the worst part, it can cause other mobilities like walk disorders, cerebral palsy. The cerebral palsy we often hear about.
Yes.
Many of those children actually suffered from neonatal jaundice. Actually, not the only cause. There are other causes of cerebral palsy, but one of which is neonatal jaundice. And of course, in worst case scenarios, and we've seen many of them, it causes death in the newborn.
Wow. Okay, so we'll go on a short break, and when we come back, the program Women's Corner continues on Citizen 93.7 FM Abuja.
Need a lift? Feeling low, bored, or confused?
Wants your dream to brightly glow?
Here is what to do.
Women's Corner is waiting just for you.
Education, work, lifestyle, career, mentorship, and family too.
We will tackle the issues, provide solutions, and see you through. Finding your voice, reaching high, and making an impact. Women's Corner, where knowledge can fly.
Join us every Mondays and Wednesdays at 1 p.m. for inspiring stories and practical advice to reach all your glories.
It's Women's Corner on Citizen 93.7 FM Abuja.
Woman don't suffer, lower everybody.
if you're just tuning in, you're still tuned to Citizen at 3.7 FM Abuja on the program Women's Corner. And this afternoon, we're having conversations around neonatal jaundice with Dr. Rukaya. Thanks for breaking that down so clearly, Doctor. But as we always say, prevention is better than cure. So let's talk about what can be done ahead of time and how families can be better informed. Is neonatal jaundice preventable in any way?
Well, its prevention boils down to health education, I think health awareness, such that couples that premarital counseling, like we said, where before marriage you do the normal test, blood grouping, genotypes, and the rest. So just like genotype is very important, blood grouping too is very important. But the issues of neonatal jaundice is such that you can't say because of that there will be no marriage between a couple. Of course, they'll get married, but they should be informed beforehand that there's even the reason why we advise mothers take pregnant women immediately you deliver, have a baby. If you are rhesus negative, you collect what we call Rugam. Rugam injection helps to reduce the sensitization that often occurs. And then, of course, the attending complications like miscarriages and, of course, a baby having a child with neonatal jaundice. That's one preventive measure. So health education can never, ever be overemphasized. Number two, it has to do with practices, cultural practices. There are some of these cultural practices that we are often advise or discourage mothers from doing. Instead of we encourage early breastfeeding, instead of giving them glucose, water, or whatever. Please, we try as much as possible encourage mothers to start breastfeeding their babies as soon as possible, and to also exclusively breastfeed if they can, and also to breastfeed on demand, and also ensure babies pass minimum of 2, 3, up to 4, depending on your child and of course the amount of breast milk he or she takes. And if for any instance at any point in time a child is noticed with any yellowish discoloration, please come to the hospital so that the healthcare worker can investigate, check first, assess, because clinically you can actually have a rough idea of the severity of the jaundice. When the jaundice is just on the eyes and probably on the face, or you want to still observe, ask regarding breastfeeding and then other practices the mother has been doing, and then encourage, and then what we call watchful waiting, and you give them short appointments. They come to the hospital, they come back to the hospital, and you now manage or treat as appropriate. Where you are seeing the child for the first time and you're already making an assessment of severe jaundice, you don't wait in such instances. You admit immediately and you place the baby on phototherapy and of course other treatment modalities, because depending on what is actually causing the jaundice. So jaundice can actually be managed if a patient or parents come to the hospital or facility early.
Yes, I like that you mentioned parents, because I would really want us to talk directly to parents and caregivers, those who are in the front line of caring for newborns at home. Now, what immediate step should a parent take if they suspect their baby has jaundice from the home?
Okay, the first step is first and foremost is assess, is that baby breastfeeding well, or was there any issue surrounding delivery? For a baby who did not cry immediately at birth, you know that there are some issues. So if a baby does not cry immediately at birth, he's weak, and so the suck reflex is actually weak too. So you know there's a problem in that instance. So for such babies you need to be assisted, where we encourage mothers expressing the breast milk and then topping up or feeding the child. You don't wait, baby is not sucking and you're just, okay, he's not sucking. You go, okay, let's get glucose and be given, or even baby formula. It's not in every instance you go straight to baby formula. We encourage as much as possible exclusive breastfeeding. So we encourage, express it into a cup and feed the child. Express the breast milk into the cup and feed the child. And in as much as the baby takes sufficient feed, there'll be sufficient stooling, and you're sure you're going to, the excess bilirubin in the blood will be excreted.
Okay.
But there are instances where you have congenital issues, just like I said, intestinal issues, enzymatic issues at the level of the liver. Usually for such, you discover that whatever you do, the bilirubin excretion is not sufficient enough, and there's a build-up. And then this build-up will now worsen the jaundice in the child. So for such instances, please come to the hospital immediately or go to any facility close to you so that the child can be assessed immediately.
Okay, so when a caregiver notices or has been informed that his child is diagnosed with jaundice, how do caregivers support babies with jaundice during treatment?
Okay, usually in the facility, we of course take in the children. We place the babies under what we call phototherapy machine, where we ensure the eyes are protected and the genitals, the external genitalia, and that's why we usually place the baby, place a pampers, diaper on the child, close the face. There's an eye cover we usually use to prevent some injury to the eyes, and then destruction of the gonads, that's the next male or female sex organs, which can affect fertility later in life. So for such, we ensure also the baby is fed. There are instances where we tell the mother not to breastfeed directly, but express into a cup. And then because we want the child to have like a minimum of particular number of hours under the phototherapy machine. So instead of giving the mother to breastfeed intermittently, we encourage mothers expressing the breast milk, and then the breast milk is now given to the child with cup and spoon inside the ward by the nurse on duty. And then we do all their supportive care to clean up the baby, place the baby on antibiotics where necessary or indicated, and of course other management modalities as indicated per child, because every child has their peculiar. And then where there's a need for what we call extreme blood transfusion, as I explained earlier, we educate the parents that this child will require extreme blood transfusion. That is the reason we do it. And these are some of the possible complications of the procedure, so that we prepare your mind to know that. And then these are the possible complications if you don't do it at this point in time. And then where you already come in a little bit too late, because there are instances where you come, maybe it's already, babies started showing some symptoms of brain being already affected, maybe due to convulsions or abnormal movement or whatever we see in the child. We educate you that, well, we're going to do this, but these are the percentage of likely outcome of this baby because it didn't come early. Yeah. And then these are the things possibly as the child is brought back on follow-up visits. We educate you on possible things to look out for. Delay in neck control, delay in sitting without support, delay in walk, some even hearing issues where the child might require the use of hearing aids later in life, where the child might require to go to special schools where there's speech issues, whatever we observe as the child is growing. Those are things that you'll be watching out for, because it's not something that you just tell the parent that this has happened. We're depending on the areas of the brain that has already been affected by that stain. The way you see the stain, outward stain on the eyes, the skin, that's what also happens on that area of the brain that's affected by the jaundice. It's become yellowish, the yellowish tinge that we see outwardly.
Okay, so before I call out the phone number, I want to ask this question. What role can community health workers play in spreading awareness, especially in rural communities?
Oh, honestly, they have a lot to do. We have found out that many a times they are the ones that worsen the complications or worsen the baby's condition, because most of the times they encourage the use of glucose, and by the time they're coming to us, many a times the damage has already been done. So we discourage the use of glucose. We encourage breastfeeding immediately. Colostrum, very importantly, immediately the baby is delivered. Immediately a baby is delivered to the mother's chest. we usually encourage within 30 minutes initiate breastfeeding. Early initiation of breastfeeding has been shown to help in the early flow of breast milk in mothers, and of course, in addition to other benefits that it actually does helps the mother with. So we encourage that, such that with every delivery, as soon as the baby is delivered, within 30 minutes, you cut the cord. Please, that child should start breastfeeding immediately. Except if baby comes out with other issues, poor cry, did not cry at all, or whatever, any other problem, or congenital issues. Congenital in the sense that he has cleft lips, and then the child cannot be placed to the breast immediately. So for such, refer immediately. So, but those ones in the grassroots, we encourage, please encourage our mothers to initiate breastfeeding early, and then we discourage use of glucose. And at any time there's jaundice, please, early morning sun is not the standard treatment. It's not standard treatment. Send them to the health facility where if there's a general hospital close by, please. If there's a facility where there's a doctor or nurses that can help to make that assessment, please, they should refer.
Yeah, so before I call out the phone numbers, there are 3 messages here, but I'll still call out the phone numbers first. The number to call is 09032229797. I take it slowly, 09032229797 or 08182222205. It's also our WhatsApp number, 08182222205. And we have 3 messages on our WhatsApp line. The first one is coming from Aziza. Good afternoon, Aisha and Doctor in the house. Afternoon, Aziza. Thank you so much for shedding light on this important topic, Doctor. Last week, my baby was diagnosed with neonatal jaundice. I am so grateful for my neighbor who quickly noticed it and advised us to go to the hospital. I am glad it's very mild and we've been discharged. Thank you so much for bringing this topic up. Thank you so much, Aziza, for your contribution. Good afternoon, Aisha and the doctor. This is my first time of hearing of neonatal jaundice, but I am glad I tuned in this afternoon. And on this particular show, Women's Corner, thank you for always trying to bring in doctors and people who would educate us. We appreciate you. Thank you so much. You forgot to tell us your name. And the last person from Leo. Good afternoon, Aisha. I'm listening to you. Esther is not in the studio today, but we miss her. I'm listening to you from Wuse too. It's a very interesting topic. Kudos to the doctor for having time to educate us. Thank you so much to Leo. The number to call is 09032229797. Doctor, before we pick more calls, if at all there are any that would come in, or messages rather, you've shared very valuable insights, on neonatal jaundice. But I still have, about 2 more questions to go. What should be your key message to parents listening to us right now?
Okay. The key message is one that neonatal jaundice is very common. It's quite prevalent. Yes. And it's something that's treatable when patient or babies are presented early. I think the major challenge generally is availability of the phototherapy machines. Where I work in a facility, I think a lot of our general hospitals do not have that. So we are like a point of referral, except for the FMCB that we also have. So I will advise that you come early, so that if there's any symptoms or any indication of an infection that can be treated, such that the rate of rise in the bilirubin can be arrested in the sense that if it's an infection and its treatment is instituted immediately with the right antibiotics or right anti-malaria, anti-protozoal treatment, you can actually reduce the rapid breakdown of the red cells, which is the hemolysis I mentioned earlier, and therefore the buildup of the bilirubin in the body. And if there's any other challenge like breast milk not coming, not flowing, there are ways that the health worker will actually assist you and of course educate you, so that with the right flow of breast milk, you discover that your child will pull more, and that will also help him or her excrete bilirubin, the byproducts of bilirubin metabolism from the system, and invariably reducing jaundice in the child. And then for a mother who has had a child or previous history of a child with bilirubin, please and please don't. There are instances where people come in, neighbors will tell you, I've used this herb, I've used these leaves, boil it, drink it. Please and please, let's be aware that it's something. That single child, first child that had the mild one, the next child could have the severe form. So don't any chances. Don't do self-medication. Come to the facility where a proper diagnosis is made, and then proper treatment will be instituted.
Yeah, so that's for all the nobodies, because a lot of them are there like, it happened to my daughter and this was the treatment I gave her.
Yes.
So if you could do this treatment, it would definitely happen to you. Doctor is trying to say that each baby has his own uniqueness to himself or herself. What happened to your baby or the treatment that was given to your baby might not be the same that the baby that came to that you're talking about requires. Like you said, there are mild jaundice and then there's severe jaundice, right?
Yes. There are mild one and a severe type.
Thank you so much, Doctor. You've been listening to Women's Corner today. We've learned that while neonatal jaundice is common, early detection and right care can make all of the difference. Don't ignore the signs. If you notice yellowing of your baby's eyes or skin, seek help immediately. It is very important. A big thank you to our guest, Dr. Rukaya Ahmed Abdullahi. We hope to have you on this show all over again on another topic, or even on this same topic, because there's a lot we need to do more in terms of awareness. There are a lot of people who still don't know what jaundice is and need to be aware of it. Thank you so much for being part of today's program, Doctor.
Thank you, Aisha. Thank you for having me.
Thank you. So, on a final note, you've learned, you've heard, and I'm sure that someone somewhere has learned something about jaundice and wouldn't allow it to happen to his daughter or her daughter or even your neighbor's child. When you see a child with yellowish, eyes or skin, please go to the nearest facility. Go to the nearest medical facility. Avoid going to all of those, old women who help in delivery. They are actually trying, but it is not their job. I am Aisha Shoaib Badegi, reminding you to stay informed, stay healthy, and always speak up for your child's health. Good afternoon, Abuja.
Need a lift? Feeling low, bored, or confused?
Want your dream to brightly glow?
Here is what to do.
Women's Corner is waiting just for you.
Education, work, lifestyle, career, mentorship, and family too.
We will tackle the issues, provide solutions, and see you through. Finding your voice, reaching high, and making an impact. Women's Corner, where knowledge can fly.
Join us every Mondays and Wednesdays at 1 p.m. for inspiring stories and practical advice to reach all your glories.
It's Women's Corner on Citizen 90.